Good evening and welcome to BBC Points West.
Our headlines tonight is the Bristol Children's Hospital in crisis. The regulator issues a formal warning over staffing levels and insists that safety standards have to improve.
Good evening. Bristol Children's Hospital is to reduce the number of heart operations it carries out after a formal warning over staffing levels.
They've also been served with an improvement notice after it was found they failed to meet certain safety standards.
It follows a series of concerns raised over the care of children at the unit, as revealed by our health correspondent Matthew Hill. Here's his exclusive report.
7-year-old Luke Jenkins from Wales died after being discharged early from intensive care onto Ward 32. This was just 3 weeks after another child, 4-year-old Sean Turner from Wiltshire, died this March after he was discharged to the same ward from intensive care.
If you haven't got the staff to make the children better, don't take them. Why rush them through?
Well, it definitely needs to be closed down.
A hospital review into Sean's death says there were not enough nurses on Ward 32 and a failure to recognise his deteriorating condition. Both families say they've been kept in the dark, which is why they've gone to this solicitor for answers. It's because of their concerns about staffing levels on Ward 32 that today's report has been released. So what exactly has been happening here on Ward 32? Well, today it's emerged that the CQC issued a formal warning to the Trust following an unannounced inspection in September.
We found that the staffing levels on the ward weren't adequate to be able to meet all those needs, and they were based very much on a basic ward model. And it meant then that, for example, children who were transferred from the paediatric intensive care unit back to the ward, who were still pretty dependent and needed high dependency type care, weren't getting that kind of support that they needed.
In response, the hospital have reduced the number of beds on the ward by 4, creating 2 cardiac high dependency beds in paediatric intensive care. And because it has fewer beds, the Trust has also decided to reduce its programme of cardiac surgery. The CQC also said they saw staff filed reports about their concerns over staffing levels in February before the 2 children died. Contacts have told me those warnings were long-standing. My sources say that consultants were writing to senior management for the last 3 years, flagging up the staff shortages on Ward 32. What do you think of that?
Dumbstruck as what to say. I mean, they're looking after seriously ill patients, as they keep saying, and they've not got enough staff to look after them, so they're just putting children's lives at risk.
They should be sent them elsewhere if they can't deal with it. Send them somewhere who can.
But generally, would you say
Their solicitor also represented families affected by the Bristol heart scandal, in which dozens of babies died because of poor surgery. Although Bristol has some of the best surgical results in the country today, their solicitor, Lawrence Vick, feels the way management are responding to concerns about post-operative care reflects what happened 20 years ago.
allowing the problems to have existed for so long is disgraceful. It's certainly got echoes, unfortunately, of the previous tragedy at the scandal at Bristol.
Although the changes came too late for these two families, their fight for answers will continue. Matthew Hill, BBC Points West, Bristol.
The Chief Executive of the Health Trust is Robert Woolley, and he joins us in the studio now. Thank you very much indeed for coming in. The concern, as I understand it, is not about heart surgery, but the aftercare. Do you accept that some children were discharged from intensive care to Ward 32 too early?
Firstly, can I offer my apologies again to the families that you featured on your broadcast tonight. There's nothing more tragic than the loss of a child, and I'm very sorry that that happened in our care. The staffing model that we've been operating until very recently is a model that was commissioned from us by the Specialist Commissioners for the South West. It's been assessed by the Department of Health in the Safe and Sustainable Review of Children's Congenital Heart Services, and it has been delivering among the best clinical outcomes in England for this sort of surgery.
Do you accept that some parents were misled into thinking that Ward 32 was a high dependency unit, just a tier or so below intensive care, when in fact it was just a general ward?
We've never pretended to have a high dependency unit. We operated a model whereby a clinical decision was made about discharging a child after surgery from the paediatric intensive care unit onto the general ward, but those children are supported by a paediatric intensive care outreach team, and the staffing is flexed.
But we know that there have been warnings about a lack of nursing care going back to 2009.
Well, what I can say is that staff are always keen to develop the service. We've invested in the service, I think, over £500,000 over the last 2 years in new medical and nursing staff. We review the ward staff on an annual basis, and we increased the establishment again last year when we did that review. And we're in the middle of that review. It was planned already.
But today you've had this very serious sounding warning.
So we've taken action already to address the concerns of the regulator. We've taken the steps that your report described, which means the nurse staffing is improving. But what I'm most pleased about is we've got commissioner agreement to undertake the development we wanted to undertake, which is to put in a high dependency care unit for children post cardiac surgery on this ward.
We have to leave it there. Thank you very much indeed for coming in. Thank you.